I have a very different story. I'm sort of an example how you can do everything backwards, do half of it wrong, and still manage to come out with a I think a half decent career. It's early days still. Um, so I didn't go straight to university after school. I did my A levels. I knew I wanted to be a scientist. So I actually went and worked in NHS laboratories. I worked for the blood transfusion service. So I was working for the blood transfusion service, trained in all of the different bits that they had to offer. So a bit of R&D, transfusion science. I did quite a lot of work around transplant medicine and actually doing cross matches for both blood transfusions and for transplants. So got a good grounding in the sciences there. My personal circumstances changed, and so I decided that I was going to go to university. So didn't go to university until I was in my 20s. So a little bit older than most of the people I was at university with. I did a degree in microbiology and genetics, which microbiology was always my first love, even though I'd ended up in transfusion science. So I had a really good grounding in the basic sciences, well, basic biomedical sciences. Um, at the end of my BSc, decided that I quite well, what had actually, okay, I better tell the full story here. I couldn't really afford to be at university. So I got myself a part-time job at the local hospital and was working 2 days a week without a knowledge of my lecturers, working 2 days a week in the local hospital laboratories. And the people that I was working for, one of the professors actually took me on one side and said, I want you to consider doing a PhD after your degree. I wasn't intending to do that. I was intending to go back into laboratory work full time. But when it actually came to it, he pointed out an advert that he thought I should be looking at. And I applied for a PhD studentship, which was actually at the same university. So this was at Sheffield University, working at the Northern General. So was accepted on that and did my PhD there. Took a little bit longer than usual, sometimes does. So it took me 4 years to get my PhD. And then I decided the last thing in the world that I wanted to do was to do a postdoc. So I actually went into the civil service, and I went into the civil service as a health and safety inspector. So I was up and down ladders, I was, inspecting factories, actually got chased out of a couple of factories. It had its exciting moments. Um, Decided that it probably wasn't for me. I'm actually a bit more of an introvert than I think I realised at the time. So I then went into the Department of Health and worked on infectious disease policy. And I think that's where my love of public health came from. I sort of landed in it, and I was using my microbiology degree. I was using my brain all of the time and thinking about epidemiology, outbreaks. I was working on the weird and wonderful. So when we had a rabies case in the UK, there was somebody that had been scratched by a bat, bitten by a bat, can't remember now. And they developed rabies. So I was working on that, West Nile virus strategy, all of that sort of work. But I felt as though I wasn't really able to progress as a scientist within the Department of Health. And I got a sideways move into what then was the Health Protection Agency and started working on epidemiology proper at that point. From there, went on to the public health scheme. So I trained in the NHS as a public health consultant and did my masters at that point at I can't say it, LSHTM. And then after that, did all of my part A, part B. So did my professional qualifications and came out of it as a consultant in public health. So I did everything backwards, but came out of it with the same qualifications as some of the other people that you'll speak to. I have had a career just in the UK. I have interests in some global health, but I've definitely worked just in the UK. I'm based in London. I trained in London, but I don't work in London. The pandemic gave us the opportunity to be able to work a lot more in terms of hybrid working and being able to work remotely. And I've been able to take advantage of that so I can stay with my family in London and only have to be in the office 2 days a week. And that's the case for a lot of people now. In terms of what I do now, so I'm the Director of Public Health in Coventry. I'm the Statutory Chief Officer for the local authority. I am appointed by the Secretary of State for Health and by the council. So I actually have to answer to both of them. I look after a number of contracts. So I have a budget of 26 million per annum and around 100 staff. I look after the sexual health service, drugs and alcohol services, the 0 to 19 services, so health visiting, school nursing. Also look after health protection, health promotion, working with the NHS, trying to make sure that they remember prevention, which sometimes can be an uphill struggle. But it's a very strategic role. I have an interest in migrants and migrant health, so I actually look after that team as well within the council. That's an additional budget, an additional number of people, and um, I'm quite involved in that from a regional perspective and also in terms of working across England with other directors of public health, so that we actually think about how we best provide services for migrants when they arrive in this country. And I found that, that was following my passion, and I found that really rewarding piece of work to do. I think the things that I developed from doing my PhD that I've taken into this work have been resilience and I saw on the chat that many of you are, third or fourth year into your PhD, and you certainly need that resilience. You need that attention to detail. You need to be able to speak to people from all walks of life, and you'll develop really good presentation skills. What I've found one of the most useful things is that critical thinking and those critical appraisal skills, which I use pretty much every day in my role. And also a knowledge of experimental design and the scientific process, which basically is why you do your PhD. And that I have certainly taken into this work. Other things that I've learned include the fact that you don't have to do a postdoc to have a career. And you have to know yourself and you have to know your values to know what's the best thing to do. And I'm sure that the careers advisors on this chat will say the same thing. It's worth actually knowing enough about yourself to be able to think, well, a postdoc is not for me. That's not what I want to be doing in my career. I think my academic career, for me in the laboratory, was over. And it was time to think about what I was going to do instead. So knowing your values, knowing what's important to you. The other thing that I'd mention is knowing your value. So actually knowing how valuable you are to employers and what you actually give back to society and to your employers and in the case of a DPH, to the population, in terms of thinking about how we try to improve people's health and well-being. And I think there's something about understanding that when you go into the workplace after your PhD, you're unlikely to be doing the same thing again, but you have those transferable skills, and actually understanding what those transferable skills are and marketing them, that's really important. I think the thing that's been the most important thing, but I learned from all of this, and it was after my PhD. You do your PhD and you're the expert. When you finish your PhD, when you have your viva, you are the world expert in that niche little area. In my case, it was bone health. And I did a lot. I can still tell you about osteocalcin, and I can still tell you about fat soluble vitamins, and the levels of obesity and what they contribute towards bone health, etc. When you go into the workplace, you don't need that level of detail. You can't be the expert in everything. You might want to be, but you cannot be the expert in everything. And you have to get used to knowing enough to be able to get by in the job and to develop other skills. So in my case, it was developing management skills and leadership skills. And I know that Kotha said that you need to maintain your learning. You continue with your lifelong learning. And I would certainly echo that, because there's something about making sure that for the different stages of your career, you are thinking about what skill set do I need. And I'm still now, 20 years since I started my public health career, I'm now in the middle of a leadership program, and it's the third leadership program I've done, all of them slightly different, all of them very useful. You don't stop learning just because you've gone into your career and you've got the job that you wanted.